a prolapsed fibroid, misdiagnosed as a molar pregnancy. This was a case of a 38-year-old multipara who had a miscarriage of a 2-month-old pregnancy a few months prior to presentation. She was admitted as a case of molar pregnancy based on ultrasound diagnosis. Vaginal examination revealed a huge soft mass occupying almost the whole vagina, but the cervix was not felt on vaginal examination. Serum beta HCG was negative. A repeat scan showed what looks like a prolapsed fibroid polyp with a pedicle floor. These are still images of the patient. This heterogeneous mass was in the vagina. Note that this mass contains both solid and cystic areas. These features are not in keeping with the typical honeycomb or snowstorm appearance of molar pregnancy. Secondly, this lesion has taken up color, which is not a feature of molar pregnancy. Here one can see the fundus of the uterus, the endometrium, posterior lip with the cervix. Beyond the posterior lip of the cervix, one can note this hypoechoic lesion, hypoechoic compared to the posterior lip of the cervix, and not somewhere here that the echogenicity here is different from the echogenicity of the myometrium. So here it is less echogenic. So this suggests that this is the origin of the pedicle of the suspected prolapsed fibroid. Again, here, note the clear demarcation between the posterior lip of the cervix and this mass. Here is the anterior lip of the cervix stretched out. Between the anterior of the cervix and the anterior border of this mass, there's a space. Look at this anechoic area here. So this is the huge mass within the vagina coming out from the endocervix. Again, this pedicle flow shows the origin of the pedicle. And you can see the flow within the cervical canal, and this is the posterior lip of the cervix. So this area is the area of the external cervical os. Now these are the surgical specimens of the same case. Here is the fundus, the endometrium, the posterior lip of the cervix, the pedicle here, and this mass. So let's look at the video. So fundus of the uterus, origin of pedicle, this huge mass, anterior lip of the cervix, stretch out here, posterior lip of the cervix, and this huge lesion within the vagina. So again, another video of this heterogeneous lesion. In the vagina, sliding the prop up, and not the pedicle here, coming out from the lower corpus. And this is the body with the uterus anterior of the cervix, posterior of the cervix, and this mass. This is exactly what was found at surgery. So this is color Doppler tracing the pedicle floor, not the endometrium. The corpuscles. the pedicle flow from the endocervix, ectocervix, and there. Now let's look at this still image and compare findings at surgery. Here is the fundus of the uterus. This is the stretched out anterior lip of the cervix. This is the posterior lip of the cervix, and not the differential echogenicity between this huge mass and the uterus. So this is the uterus, this with this splayed out cervix in here, and this and this represents this prolapse uterine fibroid. I thank the surgeon for giving me the specimen to use for this presentation. Histology confirmed this to be leiomyomatous polyp with high lionization. Yes, at times it can be quite challenging to differentiate between molar pregnancy and degenerative uterine fibroid. Here, even at surgery, the surgeon thought it was more of a leiomyosarcoma. Look at the specimen at surgery, the cut surface. But histology confirmed this to be parasitic fibroid. Again, this was a case of molar pregnancy. This was a case of suspected degenerative uterine fibroid. So at times it could be confusing, but a diligent history would be able to differentiate between a pregnant and a non-pregnant condition. So the learning points are that a brief focused history will help narrow down the differential diagnosis, and a systematic scanning technique will be able to straighten the diagnosis obtained from the brief and focused history. Thank you very much.
Allah